Now, the opioid epidemic is now the leading cause of accidental death. Pennsylvania health officials have taken action on a number of fronts trying to control the crisis.
One is focused on making Narcan more readily available, and health reporter Stephanie Stahl is here now with more from the state's physician general.
They're taking this very seriously. Naloxone has saved the lives of tens of thousands of overdose victims. Pennsylvania is one of the first states to make it available in drugstores without a prescription. Naloxone is a medication that can reverse the effects of an overdose. It's usually given in hospitals or by first responders. In Pennsylvania, there's a standing order from the physician general that it can also be purchased in drugstores without a prescription.
There's always an increased risk during the holidays.
Dr. Rachel Levine, Pennsylvania's physician general, is getting the word out to families who struggle with addiction that there's an increased risk of overdoses during the holidays and that they should have naloxone at home just in case.
Not enough families are aware of the standing order, and not enough families are aware that they can obtain this from their pharmacy.
To prove the point, Dr. Levine purchased this Narcan, the inhaled version, in a drugstore. There was a small copay. It's covered by insurance.
This is FDA approved, and this contains 4 milligrams of the medicine naloxone.
Narcan saved 25-year-old Erica Hurt, who passed out from heroin in a car with her 10-month-old crying in the back seat. Like many addicts, she'd been through rehab but relapsed.
Heroin is the devil.
It's the devil.
It is the devil. Yes, heroin addicts, including my daughter, they choose to take that first hit. But then that drug takes their soul.
Experts say heroin addiction often starts with narcotic pain medications and can happen to anyone.
Addiction and substance abuse disorder are medical illnesses. They are chronic, relapsing medical conditions. This is not a moral failing. And so we need to get people the treatment that they need.
Now, if naloxone is administered at home, you still need to call 911. Further medical intervention may be necessary, and the person who OD'd has to be referred to a treatment facility. Pennsylvania doing a lot to try to save lives this holiday season, especially.
Wow. All right. Thanks, Stephanie.